Acute abdomen is sudden onset of severe abdominal pain, which may require surgical intervention. Some medical conditions may present as acute abdominal pain. The causes are inflammatory conditions, for example, appendicitis, salpingitis, cholecystitis, perforations, for example, typhoid, peptic ulcer, and trauma. Intestinal obstruction, for example, strangulated hernia, adhesions, volvulus, and also hemorrhage, for example, ruptured ectopic pregnancy, ruptured spleen, and also acute pancreatitis, colics, for example, ureteric and biliary or intestinal. Also, medical conditions, for example, diabetic ketoacidosis, gastroenteritis, gastritis, malaria, pneumonia, UTI, sickle cell crisis, and adrenal cortical crisis, porphyria, and nephrotic syndrome. The symptoms are abdominal pain, anorexia, nausea, vomiting, dyspepsia, fever, headaches, joint pains, dizziness, vaginal discharge, dysuria, watery mucoid, blood-stained stools. The signs that are usually elicited are dehydration, fever, hypotension, rapid pulse, abdominal distension with fluid or gas, abdominal surgical scars, strangulated hernia, especially femoral hernia, tenderness, rebound tenderness, and garden. And also absent bowel sounds, increased bowel sounds, tenderness in the rectal, vesical, or rectouterine pouch. Also signs of basal pneumonia or myocardial infarction, pallor, natopathy, and frontal boson in sickle cell disease. Investigations are FBC, blood film for malaria parasites, sickling test, chest x-ray, plain abdominal x-ray, erect and supine, also 4-quadrant abdominal tap, random blood glucose, urine examination, BUE and creatinine, and ultrasound scan of abdomen. And the main treatment objectives are to resuscitate the patient, to relieve pain, to control infection if present, and to treat the underlying cause. Non-pharmacological treatments: you pass the esophageal tube and aspirate the stomach in suspected surgical cases. Pharmacological treatments: for resuscitation, give IV fluids or blood transfusion. For pain management, you give paracetamol IV. In adults more than having a weight more than 50 kilograms, give 1 gram 6 hourly as required, and less than 50 kilograms, give 1 gram 8 hourly as required, with a maximum of 3 grams daily. In children 12 to 18 years with weight more than 50 kilograms, we give 1 gram 8 hourly as required, with a maximum of 3 grams daily. And 12 to 18 years with weight less than 50 kilograms, we give 15 milligrams per kilogram 6 hourly as required, with a maximum of 750 milligrams per dose. And 2 to 12 years with weight less than 50 kilograms, we give 15 milligrams per kilogram 6 hourly as required, with a maximum of 75 milligrams per kilogram per day. Or you can give Petidine IM in adults 50 to 100 milligrams 4 hourly as required, with a maximum of 400 milligrams per day. And in children 0.5 to 2 milligrams per kilogram, repeated 4 hourly as required. Or you give morphine IV or IM in adults 2 to 5 milligrams 4 hourly as required. In children 50 to 200 micrograms per kilogram 4 hourly as required. For infectious constitutions and perforations and intestinal obstructions, first line treatment, to give gentamicin IV or IM in adults 1 to 1.5 milligrams per kilogram 8 hourly. In children 2.5 milligrams per kilogram 8 hourly. And do not give if urine output is less than 30 milliliters per hour, and avoid renal impairment. And so you give metronidazole IV in adults 500 milligrams 8 hourly, in children 7.5 milligrams per kilogram 8 hourly. The second line treatment, you give ceftriaxone IV in adults 1 to 2 grams daily, in children 50 milligrams per kilogram daily. And further treatment will depend on the diagnosis. And metronidazole IV in adults 500 milligrams 8 hourly, and in children 7.5 milligrams per kilogram 8 hourly. The third line treatment, you give ciprofloxacin IV in adults 400 milligrams 8 to 12 hourly, and infuse over 30 to 60 minutes. May be added for typhoid preparation. In children, use only when benefit outweighs the risk. In 5 to 12 years, if 10 milligrams per kilogram 12 hourly, and 1 to 5 years, give 5 milligrams per kilogram 12 hourly. Less than 1 year is not recommended. And then you give metronidazole IV in adults 500 milligrams 8 hourly, in children 7.5 milligrams per kilogram 8 hourly. Referral criteria, you refer all cases to the specialist, appropriate specialist, depending on the suspected diagnosis.